My name is Ainun
And my name is kinr.
So we're going to explain about tuberculosis disease.
In this video, we will inform you about what is tuberculosis, the causes of tuberculosis, the symptoms of tuberculosis, and the last one, the treatment for tuberculosis disease.
So, let's go!
Tuberculosis, also known colloquially as the White Death or historically as consumption, is an infectious disease usually caused by bacteria. Tuberculosis generally affects the lungs, but it can also affect other parts of the body. Most infection shows no symptoms, in which case it is known as latent tuberculosis. Around 10% of latent infections progress to active disease, which if left untreated, kill about half of those who affected. Typical symptoms of active tuberculosis are a chronic cough with blood-containing mucus, fever, night sweats, and weight loss. Infection of other organs can cause a wide range of symptoms. People with latent tuberculosis do not spread the disease. Active infection occurs more often in people with HIV or AIDS and in those who smoke. Diagnosis of active tuberculosis is based on chest X-rays, as well as microscopic examination and culture of body fluids. Diagnosis of latent tuberculosis relies on the tuberculin skin test or blood test.
Tuberculosis is caused by bacteria. The name of the bacteria is Mycobacterium tuberculosis. This bacteria most commonly affect the lungs. Tuberculosis is spread through the air when a person with pulmonary tuberculosis coughs, sneezes, or spits. Other person only needs to inhale a small amount of germs to become infected.
There are few symptoms of tuberculosis. First, a cough that lasts more than 3 weeks. You might cough up mucus or mucus with blood in it. Second, feeling tired or exhausted. Third, a high temperature or neck sweat. Fourth, loss of appetite. Fifth, weight loss. And sixth, feeling generally unwell.
The main treatment for tuberculosis is to take antibiotics for at least 6 months. If tuberculosis spread to your brain, spinal cord, or the area around your heart, you may also need to take steroid medicines for a few weeks. If you have tuberculosis but you don't have symptoms, or it's called like latent tuberculosis, you usually need to take antibiotics for 3 until 6 months. And it's important to take your antibiotics correctly and until you've completed the course, even if you feel better. If you stop your treatment early, tuberculosis could come back.
Patients with drug-susceptible tuberculosis are typically treated with a 24-week rifampin-based regimen, but adherence can be challenging, and trials have shown high clinical cure rates with some shorter regimens. A new trial examined whether a strategy involving shorter initial treatment would be non-inferior to standard treatment for rifampin-susceptible TB. In this Phase 2-3 multinational randomized open-label adaptive non-inferiority trial, 674 patients 18 to 65 years of age were assigned to either standard treatment with a rifampin-based regimen for 24 weeks, or a strategy involving initial treatment with a novel 5-drug regimen for 8 weeks, with treatment extended for persistent disease and post-treatment monitoring with retreatment for relapse. The standard 24-week regimen comprised rifampin and isoniazid, with pyrazinamide and ethambutol for the first 8 weeks. Non-inferiority was assessed in 2 strategy groups, with different initial 8-week regimens. One was based on high-dose rifampin and linezolid, and the other on bedaquiline and linezolid. Both also included isoniazid, pyrazinamide, and ethambutol. The primary outcome was a composite of death or ongoing treatment or active disease at 96 weeks. The proportion of participants with the primary outcome was 3.9% in the standard treatment group, 11.4% in the rifampin linezolid group, and 5.8% in the bedaquiline linezolid group. The strategy that included initial treatment with the bedaquiline linezolid regimen was non-inferior to standard treatment. The incidence of grade 3 or 4 adverse events was similar in the 3 groups. The authors conclude that in patients with drug-susceptible TB, a strategy involving initial treatment with an 8-week bedaquiline linezolid-based regimen was non-inferior to standard treatment with a 24-week rifampin-based regimen with respect to clinical outcomes.
We have already explained about the causes, symptoms, and the treatment for tuberculosis disease.
Finally, this part is the end of the video.
I'm Afra Septikanya.
I'm ainun
And I'm kinr from 11th grade. Would like to thank you for those of you who watched the video from the start until the end. Hope this video could be useful for your personal information. That's all from us. Thank you and goodbye.